Still on Signature New Day, we're still talking hepatitis in Nigeria, and statistics say over 20 million Nigerians live with hepatitis. However, just a little bit under 5% are aware of their status. Now the question now is, are there drugs available to treat those who have been tested and confirmed with hepatitis? And if there are drugs, how available are those drugs to the average Nigerian? Joining us on studio is pharmacist Oluchi Muoghalu. She is a pharmacist with UNTH Itukwuozala, and she will be unpacking some of these questions that you have concerning treatment, availability, and accessibility of drugs for hepatitis. Pharmacist Oluchi, thank you for joining us.
Thank you for having me.
You look rather smashing this morning.
Thank you very much.
You're welcome.
I'm sure the weather is very good for you.
Yeah, it is.
It is very good, of course. Okay, so I would like to ask, of course, you're a pharmacist and you've had experience, I want to believe, with hepatitis cases like that. Yeah. So what are the most commonly prescribed medication for hepatitis?
Okay, so the drugs prescribed for hepatitis basically depends on the type of hepatitis that a patient is affected, because we have hepatitis A, B, C, D, and E.
Yes.
So for hepatitis A, there's a vaccine available to prevent contracting the infection. However, for hepatitis E, which is also, transmitted through the fecal-oral route, there's no available vaccine yet. Okay. Well, for hepatitis B, which is, transmitted through the blood and body fluids, we have vaccines as well. Usually, we have the birth dose that are given to children within 24 hours once they are given birth to, and then the booster shots are given, at subsequent weeks from the 6th week, 10th week, and 14th week of birth. Then for patients that get infected in maybe adulthood or as adolescents, there are antiviral agents that are available, although the acute form of the infection is self-limiting in the sense that it can resolve on its own after probably 6 months. It resolves on its own. However, if it moves on to the chronic stage, there are antiviral agents that are available, and then what these antiviral agents do is they prevent the replication of this virus in the patient's blood, and then they also boost the immune system of the patient to be able to reduce the viral load in the body. So yes, there are vaccines, and then there are drugs available for the other types of hepatitis.
Okay, so you just said something now that struck me. You said some of these infections, hepatitis infections, they are self-limiting, meaning that the body gets to resolve and push away this virus.
Yes.
So my question is, if someone contracts hepatitis, is the person allowed not to be treated until after a certain time and it's seen that it's not being resolved, then you commence treatment? Is that what you're saying?
Yes.
Can you just take us through that, pathway?
Okay, so the WHO guideline that was released March this year, it's listed some criteria or some eligibility status that needs to be reached before a person gets treated.
Okay.
So usually, once the infection is noted, you carry out tests to detect the viral load, and then you monitor the patients, the liver enzymes and their functions. And then if it's if the antigen, that's the hepatitis B surface antigen, if it's still detectable in the person's blood after 6 months, and then if the person meets the other criteria set by the WHO, then treatment can commence. But however, for the first few weeks, there's no basic treatment that starts immediately.
Okay. You spoke about antiviral medications.
Yes.
Can you just put us through how they define their effectiveness for various types of hepatitis?
Sorry, can you rephrase the question?
Okay. You spoke about having to have antiviral medications for each of these hepatitis that you said were different. Well, we know, of course, that there's A, B, C, D. So which of them are most effective? How do we have them?
Okay. The drugs are actually very effective. For hepatitis B, the antiviral agents available to treat hepatitis B are very effective. And so far, we've not noticed any case of resistance yet. And then after some time, we notice that the viral load of the patient, decreases.
Yes.
And as well, we have antiviral agents that completely cure hepatitis C. So we have these direct acting antiviral agents that, cure hepatitis C currently. So I would say the antiviral agents are very effective. Yes, yeah.
Okay, pharmacists, with antibiotics, there are guidelines. I'm sure there are guidelines with antivirals. With antibiotics, you have what they call, I think, aware guidelines, where their access. Beautiful. Do you have that kind of arrangement with antivirals? Are they first-line drugs for hepatitis? Are they over the counter? So just paint a little bit of a picture. I guess that's what my co-host wants to know about. Okay, these drugs, they are the first-line drugs, and if they fail, you now go over to this, other treatment options. Okay,
yes, definitely. We have guidelines that were also released by, the World Health Organization. So we have the first-line treatments that are given based on, however, these drugs are given based on the patient's characteristics. So we have the drugs that are given given to children, between greater than 2 years, and then adolescents and adults as well. So we have first-line therapy, but so far, we have 2 major drugs that have been shown to, have less resistance.
Okay.
Yes, we have those first-line. We have the alternative first-line medications as well, and then we have second-line drugs that are specific for people that have certain kinds of conditions, like osteoporosis and maybe kidney, reduced kidney function. So we have drugs that are used for those patients as well.
Yeah.
Okay. So I like to ask this question because, I don't know, it kind of give me insight on my guest as well. Can you tell me about your own first experience in handling a patient that had hepatitis, and which of them did they have?
Okay, so there was a patient we had that she was supposed to, she got a job opportunity, like an employment, and then she was requested to come for this necessary test, the HIV, syphilis, and hepatitis virus test. So she came to the hospital, and after doing the test, she realized that, she had hepatitis C virus, the infection. And at that time, there was no
cure as yet.
Yes, as at then. But now, like, we've had medication. So currently, she's on this hepatitis C virus infection medications now. And it's supposed to run for 3 months. So currently, she's on it, and her viral load is decreasing greatly.
Okay, so before I get to my question, you said her viral load is decreasing, which means intermittently she goes for viral load testing.
Yes.
But you said hepatitis C is curable.
It's curable. Like, you have to take the drug for 3 months.
Of time.
Okay.
So within that period,
so she's still within that window.
Yes. So from time to time, she goes to check, the viral load to see if it's actually reducing. Just like note if she's adhering to the medication.
Okay.
Because the efficacy of these medications depend on the patient as well.
Host factors. Can you tell us some of those host factors?
Okay, so most times some people have allergies to drugs, and then sometimes their kidney function also determines how well they're able to metabolize these drugs and how they're able to use it. And then also their adherence is a major factor, because suboptimal adherence, when a patient doesn't take these medications the way they are supposed to, it doesn't give the required goal of therapy that we would like to see in that patient. So we as pharmacists, we try to educate our patients on the need to adhere to their medications to ensure that, this viral load gets suppressed, and then the disease condition doesn't progress to, liver cirrhosis, failure, and liver cancer. So, but we need to the main thing is just about educating the patients,
All right, pharmacists, what are some of the side effects of these antiviral medications that you spoke about? If a patient, take for instance the lady you just spoke about now, what are some of the things that you begin to notice? She's adhering, she's checking her viral load. However, there are some symptoms she's noticing in her body that may be pointing towards reactions to the drug. So what are some of these side effects that come with taking antiretrovirals for hepatitis? Okay,
the side effects for these antiviral agents are not so severe. They're like the mild side effects that you would notice, like fatigue, nausea, vomiting. And then these effects can easily be controlled with some antiemetics and other supportive therapies that we give to these patients. So the side effect is not so severe that it can't, it will hinder the person from taking their medications the way they're supposed to.
Okay, so I know I used to have issues with following prescriptions. Like the doctor tell you take 2 a day, 2 the night, and then sometimes you just you just keep like. So I want to know what is how important it is for me to adhere, and of course you said for this hepatitis C it takes 3 months. So let's assume that I was supposed to take maybe once a week, and then I missed probably twice, like I missed 2 weeks consecutively. How bad is it for me?
It's actually very bad because I won't really want to go into much detail, but there's a level, like the reason why we give drugs at certain intervals is because we need the drug to get to a certain level where it begins to elicit its effects. So if you miss, probably if you're supposed to take a drug like 8 hourly and then you take the first dose, you don't take the second dose, the effects of the drug in the body tends to diminish, and then it doesn't give you that effect that we would expect it to have. So it's important that once you are giving your medications, you stick to, the timing, the dosing regimen. And however, there are efforts that are being made now to kind of produce fixed dose combinations, where a patient is supposed to take maybe 2 drugs together. So we're trying to formulate it into just a single tablet.
Okay.
So this will reduce, so it reduces the pill burden, because you see people that they don't like taking a lot of drugs. You see people taking maybe 5 drugs, they don't like it. So we're making efforts to combine these drugs into. It was also one of the strategies that were proposed by the World Health Organization.
Will it be done locally?
I don't think it can be done. So we'll have fixed those combinations, and they're once daily dosing, where you just take your drug once in a day and the next day. So it doesn't create this adherence problem. You can easily stick to your medication, because you need to the patient on their own need to understand their disease condition and know why it is important for them to take this drug throughout their life if they actually want to lead a healthy life. So we explain this.
Yeah. So just like you said, this is your last sentence. It's very important for the patient to understand their condition. Now, if you tell a patient that you have HIV, take these drugs, of course they will take it very seriously. Have you experienced a patient that did not really understand what it meant to have hepatitis, and then they just took it with nonchalant attitude?
Yeah, definitely. We've had patients like that. Most of these viral infections or these diseases that are strange to people, there's this kind of stigma and discrimination around it. So even when you explain the disease condition to them, most of them, because of the how affordable these drugs are, they don't really tend to stick to their medication. So even if you explain that, you need to take your drugs, this is the condition you have, you need to adhere, most of them, when they come back for their follow-up visits, you notice that the liver tests are still kind of abnormal. So all these things are everybody's hand needs to be on deck. We just need to explain, go around, create more awareness on this disease condition, because it hasn't really gotten as much noise or as much awareness as other diseases like HIV, malaria, which people are conversant with. So there's need for education for patients to understand that
Okay, there. So it is said that if people know better, they do better, right? I want to, because you said something that because probably the drugs are cheap and affordable, they don't really take it seriously. Was that what you said?
No, I said because they are they are not so affordable.
They are not so affordable.
Yes, they are not so affordable.
And then you mentioned something that said these drugs are expected to stay in the blood for some time to elicit the affected outcome. Now, I do understand that there's something in your field called pharmacodynamics and pharmacokinetics. Can you just explain to us the pharmacokinetics? How does this drug work in the body? Tell them so that they will know that they need to take it for this length of time so that it can maintain a particular level in the body before it starts working. At least if they have that information, the next time they want to skip their drugs, they'll be like, if I skip, the level will not get to that point.
This is the implication of me skipping.
That is the implication of me skipping. So just as much as you can, just take us through that journey.
Okay, so like I said, what these drugs do, like their mechanism of action,
Yes.
is to reduce the viral replication. They prevent the virus in the body from replicating and becoming,
More.
So once once you take the drug and it's there, it prevents that replication process from occurring, and then the viral load, because when you go for tests, they'll test your viral load and everything. The viral load reduces, meaning that the drug is, affecting the replication of those viruses. But then once the drug is not in the system, the virus has a chance to replicate and then go on to damage the liver further. And most times they even damage other organs like the kidneys and probably the heart. So the drugs need to be in the system within the specified, at the specified interval, to ensure that this process doesn't occur, and then the immune system is also, boosted.
Okay, so finally, of course, we do not have enough publicity, and that's why this show is going on, for publicity to be made. In a few minutes, just, educate people, give them an overview of what they should know about hepatitis. Of course, we know that the B is more dangerous, yes.
Yeah.
Then we have the C that is curable.
Yeah.
How about the E and the D and the A?
Okay, so for hepatitis A and E, those ones are transmitted through the fecal-oral routes. That's when one ingests the food or water that has been contaminated by the stool or feces of an infected patient. So for that kind of hepatitis, it's important that people practice good hygiene, proper sanitation, and then, avoid sharing probably toothbrushes with people that have those infections. And for hepatitis B, C, and D, which are transmitted through the blood and body fluids, such as during mother-to-child transmission,
Yes.
and then also sharing sharp objects like razors, clippers, and then some practices like local circumcision, tattooing, giving tribal marks, and also unprotected sex. So for those conditions, you have to practice safe sex, use protection, and then avoid sharing sharp objects. And also for the mother-to-child transmission, prophylaxis can be given to the mother while she's pregnant, and also once the child is given to, the vaccine is given within 24 hours with the booster shot. So everyone is safe, then get tested. If you get tested and your status comes out negative, try as much as possible to get vaccinated. It's just 3 doses over a year or so. Then if it's positive, just start treatment as soon as possible so that the viral load can be suppressed. So have a good quality of life.
All right, great. Thank you so much, pharmacist Oluchi Muoghalu. It was such a pleasure sitting and discussing with you. There you have it, the issues around treatment, drug availability, and complications that come with treatment of hepatitis. Please don't go nowhere, because the discussion continues right after the break. Stay with us.